Hello. This evening we'll be reviewing patients with mental and physical disabilities and considering how we may approach these patients to give them optimal care and help accommodate their special needs. Our objectives today are there on the screen. You can go ahead and review those at your leisure. So what can cause a disability? There is a myriad of causes, everywhere from physical to developmental, genetic, problems at birth, poverty and cultural deprivation. In other words, many paths have led our patients to where they are and how they present today. Some examples of disabilities we may encounter can include a more archaic term of mental retardation, autism, cerebral palsy, epilepsy, traumatic brain injury, developmental disabilities, and seizure disorders, all of which are also complicated in our practice setting with cultural differences, making it even more challenging to sometimes provide for the needs of this patient population. One thing that's very important is during your nursing assessment is to make sure you understand their functional limitations and that these are documented on the healthcare record so that we can plan care according to their specific needs, considering things like communication, health and safety, social skills, etc. These will all affect how we approach the patient and as well as what type of care the patient might need. Hearing impairments are relatively common. These can include deafness, complete or partial inability to hear. Total deafness is rare and it's usually congenital, but there is many of our patients with partial deafness which may have come at birth or maybe as a result of occupational injury, ear disease, or degeneration of hearing mechanism with age. You may have to consider the utilization of sign language, or if they are lip readers, ensure you have eye contact, speaking slowly, and using hand gestures to communicate effectively. Visual impairments, there's a very large scale of this. Normal vision really depends on that passage of light from the front to the back of the eye, and any conditions that obstruct that passage can cause vision loss. They may be totally blind or have partial loss of vision that affects central vision, peripheral vision, or both. Some special considerations: make sure you give your explanations clearly, lead patients and guide as required or as requested by the patient, and make sure you explain the environment and your procedures very clearly. Speech impairments can cause some challenges with communication, and we have to work very hard to make sure we clearly understand the needs of these patients. So these can be disorders of language, articulation, voice production, fluency, and again, all of them can impair their ability to communicate effectively. So what can we do? Slow down. Listen carefully. Use simple questions, and use the caregivers that are accustomed to communicating with them. Patients with paraplegia and quadriplegia in the community particularly will have multiple difficulties and will require, may require our assistance. So this could include weakness or paralysis of both legs and sometimes part of the trunk. Quadriplegia is weakness or paralysis of extremities and trunk. This is usually as a result of nerve damage in the brain and spinal cord, and both can be accompanied by loss of sensation and urinary control. So work clearly with the caregiver, accommodate with assisted devices in our visits, and as well plan for those as part of our assessments, including how well they're functioning, and really pay attention to things like respiratory compromise, which can deteriorate over the lifespan of our patients. In terms of developing disabled, this can be impaired or insufficient development of the brain, which can cause inability to learn at the usual rate. This can be unsatisfactory parent interaction, severe vision or hearing impairment. There could actually be brain damage, severe diseases of organ and systems, and this can vary in severity quite greatly. And of course, we also have the effects of alcohol and drug use during pregnancy may lead to some of these challenges as well. So they may have difficulty with walking, hand-eye coordination, listening, language and speech, or social interaction, all of which can lead to a myriad of poor health outcomes. Down syndrome is a very specific presentation, well, not really presentation, but it has very unique features. It can cause mild to severe mental retardation. It's a result of a chromosomal abnormality. They have a unique physical appearance to differing degrees in every person. Eyes slope upward. Folds of skin on either side of the nose cover the inner corner of the eyes. Small face and facial features. A large protruding tongue. Flattening on the back of the head and short, broad hands. In other cases, we may have some of our patients who are emotionally impaired, and this can include those with nervous exhaustion, anxiety disorders, compulsion neurosis, or hysteria. It can result in both physical and mental symptoms attributed to mental stress in somebody, and they're not usually acutely psychotic. In this case, that would be a different presentation. They may have the inability to cope with normal responsibilities of life, and they may have in some cases where you've got mental retardation, they do tend to classify that as mild, moderate, or profound. There are multiple causes and accommodations that may be needed. Some common syndromes associated with mental disability can include fetal alcohol syndrome, which we may or may not be familiar with in our practice, which is caused by drinking during pregnancy, leading to severe learning disabilities and, unfortunately, behavioral disorders. They will have physical appearances that may include small eyes, thin upper lip, large ears, and shortened fingers. We already talked about Down syndrome and the fragile chromosome syndrome, which is an inherited disorder. They will have the short attention span, repetitive speech, lack of eye contact, and they will have large ears, loose joints, long face, prominent forehead, and chin. So again, each of these syndromes, there's different physical presentations, but most importantly, if we notice our patients that are having challenges, is to get them diagnosed and assessed so that we can help identify underlying issues and provide care plans that accommodate their needs. Arthritis is a specific degenerative process with pain, stiffness, swelling, and redness, many forms and varies. In osteoarthritis, we have cartilage loss, wear, tear of the joints, or rheumatoid, where it's an autoimmune disorder. The main reason for putting this in with special needs is it is a chronic issue that does lead to permanent mobility challenges and requires careful assessment and accommodation. Cerebral palsy is a non-progressive disorder of movement. It's caused usually by damage to the fetal brain during later months of pregnancy, birth, or newborn period, occasionally in early childhood. They may present with hearing defects, epilepsy, and other CNS disorders may be present. Cystic fibrosis is an inherited metabolic disease infecting the lungs and digestive system, often occurs in childhood. It's a defective recessive gene inherited from each parent, and this can present with respiratory and physical challenges. Multiple sclerosis is a progressive CNS autoimmune disease where you have actual damage to the myelin in the brain. Cause is unknown, but it may be a heritable or viral component, and there's we do see some case clusters in certain industrialized areas, but there's been no firm connection made. Usually begins early in adult life and then resumes years later. Muscular dystrophy is another specific presentation that includes inherited muscle disorder with a slow degeneration of muscle fibers. Polio, which is, again, should be generally prevented disease, but we're now starting to see an uptake around the world due to some of the vaccine hesitancy. And it's an infectious viral disease spread through direct and indirect contact by airborne transmission. It was previously in decline, but we are now again seeing an upsurge in this disease. Patients with previous head injuries can have a variety of presentations. It can affect cognitive, physical, and psychological skills. And this is where obtaining a history and performing assessment and patient care procedures may be difficult. They may not be able to cooperate, or they may not be able to provide a thorough assessment. So being aware of this and altering your approach could be helpful. Family members and caregivers may be involved in managing the patients, and they may have to let you know what is normal for the patient. And this kind of applies to all patients with difficulties communicating. Often their caregivers are going to know what is normal and help you make your baseline assessment. Spina bifida is a specific congenital defect with one or more of the vertebrae fail to develop. Parts of the spinal cord are exposed, and it can range in severity from minimal evidence to severe cases where the legs may be deformed with partial or complete paralysis and loss of sensation below the defect. Traits to consider when you're altering your approach to any patient with special needs is, consider what their vocabulary is and alter the way that you communicate. Consider speech impairments and give them time to communicate. They may be unable to read or write, so consider how you assess or how you gather information. They may also say what others want to hear because they do fear being abandoned or not protected. So make sure you're paying attention to those nonverbal cues. They may have difficulty understanding directions or answering questions, and they may take things quite literally at face value, which could be challenging when you explain procedures and those types of things. So again, folks with disabilities, they've often become very dependent on others, so they can be easily influenced and anxious to please. They can be easily victimized and easily frustrated because they cannot understand what is being said. They often don't want their disability to be noticed. They'd like to be treated with dignity and respect like any other person. They have difficulty making changes, reading, using the telephone, giving accurate directions, and they may be unable to pick up on social cues. Remember, they are often vulnerable. They can, in some cases, be segregated from others. They're heavily dependent on caregivers. They're usually praised for compliance, hence they continue to comply, whether or not it's in their best interest. They're easily persuaded and led by others, as in some cases they're quite dependent. They may have impaired judgment, and they're not trained on safety or basic legal requirements. So what's your approach? As always, speak directly to the person. Keep your sentences short and focused. Use simple and clear language. Speak slowly and clearly. Ask for concrete descriptions. Break complicated instructions down into smaller pieces. Use pictures, symbols, and actions to convey meaning. Further, and I think this is important for almost any patient that's having challenges understanding whether they have a disability or whether they are just overwhelmed. Take time giving or asking for information. Repeat questions more than once if required. Avoid confusing questions about reasons for behavior. Don't speak louder in an effort to increase the person's understanding. Use firm and calm persistence if the person is non-conforming, and avoid yes or no answers. The most important thing is keep an open mind. Don't assume he or she can't understand or communicate. Be genuine in your desire to understand him or her, and demonstrate the same respect that you would give to others without a disability. Thank you. This completes this lesson.